Colon cancer is a silent killer that affects millions of people every year, and it's important to know the warning signs before it's too late. Imagine going through life not knowing that a small tumor is slowly growing inside of you, causing you pain and discomfort, and eventually leading to your death. But what if there was a way to detect colon cancer early, before it's too late? In this video, we will explore the 4 warning signs of colon cancer that you should never ignore, and the steps you can take to prevent and treat this disease. Are you ready to take control of your health and protect yourself from colon cancer? Colon cancer, also known as colorectal cancer, is a type of cancer that affects the colon and rectum. It is the 4th most common cancer in men and women, and the 2nd leading cause of cancer-related deaths in the United States. It's typically discovered through routine screening tests such as a colonoscopy, but can also be found after someone experiences an emergency medical condition such as an intestinal obstruction or perforation. Sometimes, it's even detected when someone has less extreme signs and symptoms. It's important to be aware of the warning signs of colon cancer and never ignore them. The first and most common symptom is a change in bowel habits, such as diarrhea or constipation, or a change in the consistency of your stool. This symptom is more common if the tumor is on the left side of the colon. However, it's important to note that many people with colon cancer may not experience any symptoms at all in the early stages, which is why regular screening tests are so important. They can detect colon cancer before symptoms appear, when it is most treatable. It's also important to note that these symptoms can also be caused by other conditions such as irritable bowel syndrome or inflammatory bowel disease, and it is important to consult with your doctor for proper diagnosis. The second warning sign is HEMATOCHEZIA or melena. HEMATOCHEZIA is the passage of fresh blood through the stool, and melena is the passage of partially digested blood, which makes the stool have a dark tarry appearance. HEMATOCHEZIA is more often caused by rectosigmoid tumors, and melena is more likely when the tumor is a right-sided colon cancer. These symptoms can also be caused by other conditions such as hemorrhoids or inflammatory bowel disease, which is why it's important to consult with your doctor if you experience any of these symptoms. In some cases, these symptoms may be caused by a small polyp or benign lesion, and your doctor may recommend regular screening to monitor any changes. The third warning sign is abdominal pain and/or abdominal distension. This can occur with tumors at any site in the colon and can be caused by a partial blockage from the tumor or if the tumor causes a rupture in the wall of the colon. If the cancer is in the rectum, it can also cause rectal pain, diminished caliber of the stool, or tenesmus, which is the feeling that you need to pass stools even though your bowels are already empty. These symptoms can also be caused by other conditions such as gas, constipation, or an infection, which is why it's important to consult with your doctor if you experience any of these symptoms. It is also important to note that abdominal pain or discomfort may not be caused by the cancer itself, but rather the treatment you may be receiving such as chemotherapy or radiation therapy. The 4th warning sign is unexplained iron deficiency anemia. This is a result of unrecognized blood that is lost in the stool and is more common with right-sided colorectal cancer. This is why it's important to consider colon cancer as a diagnosis whenever someone has unexplained anemia with low iron. Other causes of anemia include heavy menstrual bleeding, blood loss from other sources such as a peptic ulcer, or a lack of iron in the diet. Your doctor will be able to determine the cause of your anemia through blood tests and provide appropriate treatment. It's also important to note that anemia can also be caused by other health conditions such as chronic kidney disease. Therefore, it is crucial to consult with your doctor for proper diagnosis. It's important to note that age is a major risk factor for sporadic colorectal cancer, with the incidence beginning to increase significantly between the ages of 40 and 50. We're also seeing colon cancer becoming more prevalent at younger ages, which seems to strongly correlate with certain lifestyle risk factors such as tobacco use, alcohol use, and the food we eat or don't eat. In addition to these risk factors, a family history of colon cancer, a personal history of polyps, inflammatory bowel disease, or obesity also increase your risk of colon cancer. It is important to know your family history and to discuss it with your doctor in order to determine if you should start screening earlier or more frequently. If you have any of these symptoms, or if you have a positive fecal occult blood test, the next step would be to have a colonoscopy for diagnosis. A colonoscopy is a procedure that allows the doctor to look inside the colon and rectum using a flexible tube with a camera attached to it. This procedure can not only diagnose colon cancer, but also detect and remove polyps, which are abnormal growths that can turn into cancer over time. In some cases, 20 of patients with colorectal cancer present with metastatic disease, with the most common sites being lymph nodes, liver, lungs, and peritoneum. This means that the cancer has spread from the primary site in the colon or rectum to other parts of the body. This can make treatment more challenging, but advances in treatment options have led to improved outcomes for those with metastatic colon cancer. It's important to take the necessary steps to prevent colon cancer, such as getting regular screening tests starting at age 50 or earlier if you have a family history, or other risk factors, maintaining a healthy diet high in fruits, vegetables, whole grains, and limiting your intake of red and processed meats. It's also important to maintain a healthy weight, engage in regular physical activity, and not smoke or use tobacco. Adopting a healthy lifestyle, eating a balanced diet, and getting regular exercise can all help reduce your risk of colon cancer. Colon cancer is a serious disease that can be prevented and treated effectively when caught early. By being aware of the warning signs and risk factors and taking steps to reduce your risk, you can protect yourself from this disease. It's important to consult with your doctor if you have any concerns or symptoms, and to get regular screening tests as recommended by your doctor. With the right care and attention, we can work together to prevent and treat colon cancer, and improve the chances of survival for those who are affected by this disease. Regular screening, prompt diagnosis, and appropriate treatment can save lives and improve the quality of life for those affected by colon cancer.